Hello everyone, my name is Nana Mokhtari and today is February 20th, 2024. Today I will be doing a presentation on Addison's disease. Addison's disease, which is also known as primary adrenal insufficiency or hypoadrenalism, is a rare chronic condition in which your adrenal glands don't produce enough of the hormones cortisol and aldosterone. The most common cause of this disease is an autoimmune response, where the immune system attacks your own adrenal glands and adrenal cortex. Another cause of Addison's disease can also be infections, such as tuberculosis, or TB for short. Although this bacterial infection typically attacks the lungs, it can also spread throughout the body and attack the adrenal glands as well. Other causes of this condition include cancer involving the adrenal glands or surgical removal of the adrenal glands or cortex due to the tumor. The signs and symptoms of Addison's disease are similar to other conditions with hormonal imbalances. That's why it's so hard for us to treat it or even diagnose it. Symptoms of Addison's disease include fatigue, loss of appetite, unexpected weight loss, hypotension, craving salty foods, low mood or irritability, depression, urinary urgency, polydipsia, or hyperpigmented patches on the skin. To diagnose Addison's disease, the primary care physician, or PCP, would first have to find out if you have a family history of autoimmune disorders. Your PCP would also check for orthostatic hypotension, for instance, where they would put you in a laying down position or sitting position, take your blood pressure, and then stand you up and take it again to see if the blood pressure drops, which is also called neurogenic orthostatic hypotension. Additionally, blood work would be performed to measure the levels of sodium, potassium, and cortisol in your body. A low sodium, a high potassium, or a low cortisol level may indicate Addison's disease. You may also need to follow up with an endocrinologist to have your blood tested for a low level of hormone of aldosterone, a high level of adrenocorticotropic hormone, which is also shortened to ACTH, to see if your blood work shows a low level of glucose, which is hypoglycemia, which sugar is used for energy, could be why people are fatigued, and a positive adrenal antibodies, which indicates antibodies designed to attack the adrenal gland. People with Addison's disease also often have an underactive thyroid, which is also known as hypothyroidism, where the thyroid gland does not produce enough hormones, so your endocrinologist can also check for that. To treat Addison's disease, patients will have to take medications to replace the hormones their body does not make. For instance, patients could be on a steroid treatment for the rest of their lives to replace their hormones, cortisol and aldosterone, that the body doesn't make. If the cause of the Addison's disease is due to an infection like TB, then the patient would also need to be treated with antibiotics to treat the tuberculosis that's attacking the adrenal glands. Typically, patients are on a steroid course for the rest of their life, whether it be prednisolone or another type of steroid. Thank you for listening to my presentation. I hope you all have a great day.